All right. Good morning, Dr. Hale. I'm so excited to finally have you on. I feel like this is a really long time coming. We've had to reschedule a bunch of times because life just
Yes,
happens. So welcome.
absolutely. Thank you, Brittany, so much for having me. Seriously, it's great as a working mom. You're busy, I'm busy, but we finally made it happen, and I'm so glad.
Yeah, and I'm so excited. I mean, I want to first start by I want you to tell us a little bit about yourself. For
I would love
anybody
to.
that might be just listening to the podcast for the first time, maybe unfamiliar with what airway focused dentistry is, let's hear about how you define airway dentistry, what kind of led you down that path, and just tell us all about you.
Yeah, I would love to. So I have kind of a unique experience growing up in dentistry from like filing charts back when they were paper and calling recall to let you know you were due for your checkup and cleaning. My parents are both dentists. They met in dental school actually.
That's adorable.
And I had such a blessing of a life of really understanding like the front and the back in a dental practice. And so I knew I wanted to go to dental school. Obviously, I did. And when I got out, I was doing a lot of surgery. My dad was a big time implant dentist in Houston at the time. So he is slowly retiring. He's slowly retiring this year, but taught me a lot. And I started learning that there were some things that we were dealing with as the general dentist that could have like an underlying meaning or root cause. But I mean, that was like, it was so far off my radar. I am so not the dentist today the dentist back then that I am today. But I was just hearing that like maybe tooth grinding could be an issue, and it was such a problem in the practice because you could loosen abutment crowns for implants, and they were breaking their own crowns or their teeth or whatever. But it was just like an afterthought to me. Like I don't know, we make a night guard or whatever, which obviously I think very differently now. So somewhere in there, I was like, you know what? I've heard that we should maybe do a sleep study. But again, I didn't know what I was doing. I didn't have my own machines or anything like that. But I found a company that was doing them virtually. And I would just tell the patient, like, hey, I've heard this could be a thing. Like, honestly, I have no idea. But if your sleep is poor or maybe you're snoring or something, like, you should go to this website and have them do a sleep study for you. So that's kind of how it all started because I would recommend it. And it was done after that. Like, there was no follow up, there was no systems in our practice for obstructive sleep apnea. And PEDS wasn't even on the radar. I mean, kids, I didn't even know what myofunctional therapy was. Okay. This was like so long so different than it is now for me. But they were coming back with sleep apnea, and I would always get a copy of the report. So I was just like, oh my gosh, like this patient was grinding their teeth and they have sleep apnea. Like that's wild. Or I saw abfraction lesions or like recession or whatever, and they have sleep apnea. So that's kind of where it all started. And yeah, I took a bunch of courses, lots and lots of money, lots and lots of education. And the pediatric side of what I learned really transformed my life, not only for my own family, but for all the patients in our community. And yeah, so it's been such a fun journey. I don't do any general dentistry anymore, so I kind of have that transition from absolutely crazy practice to the ortho and airway side, which has been such a blessing for me. And I mentor a lot of doctors around the United States now. So we have weekly calls together going over cases and stuff. So it's been really fun. That's kind of it in a nutshell.
Yeah, and tell us a little bit about your practices, your growing practices, I should say.
Yeah. So we had two offices back in the day. My dad had his original office that we still have. He's been practicing 45 years. And we have one satellite that has the same name. So my practice forever, the one I grew from the ground up in Airways, called New Teeth Dental in Sun League City. As my husband and my husband and my sister are also dentists, by the way.
Oh
So
my God,
like
I
as
love this.
everybody was getting out of dental school, my dad was like, "We need more offices or whatever." My husband and I went ahead and just bought our own practice together. I never worked there, but we bought a practice about 30 miles from where I was where we were living. And slowly but surely, we started partnering with really good friends of ours. Like, hey, you're a general dentist. Do you want to open a practice together? We've got the liquidity to do that. Like, let's go do it together. And so at one point in time, we had 7 general dentistry offices in Houston.
Wow.
And it was just a lot of fun, a lot of work, a lot of learning, a lot of brain damage, we like to say, just
Mhm.
like having that many offices.
Mhm.
And as my airway practice was booming, I realized that I really needed to extend my reach. And I couldn't do that if I was like chair side every single day of my life. I had no time for the business or mentoring other doctors or whatever. So as time went on and my executive team realized what I was doing in New Teeth with Airway and how like incredible that was for patients' lives and the number of new patient referrals we were getting just from word of mouth, we decided that we should sell the general dentistry practices and open specifically pediatric ortho and adult airway practices around Houston. So that has been such a journey. We opened the first, well, we started construction in 2022 for our very first The Airway Dentist location, and it's in Sugar Land, Texas. And about a year later, Friendswood opened. Now we have Atascocita that has opened. These are just cities in Houston.
Yep.
And three more that are going to open in the next 6 months. So we have a goal of getting to 10 locations really as quickly as possible. And my role as the chief clinical officer is to find really great dentists, train them, make sure they do everything exactly how it would be done if it was done by Kalli Hale at New Teeth Dental. And so far, it has been an amazing journey. We have a lot of things that we do and systems in place for the practices to make sure that they run seamlessly and they all work together. And it's been a wild ride. So yeah, the Airway Dentist is my absolute new business venture in the last like 3 years.
Awesome. Oh my God, that is so incredible. Now, how do you go about, because I have some local colleagues of mine who want to shift their gears and leave, traditional chairside dentistry and focus more airway, but they're really having trouble finding doctors. And of course, they want to find a doctor that they also can then train to do airway and all of that. So I guess my
Right.
question to you is, how are you finding these doctors? Are they more like, new dentists coming out of dental school? Because I assume the exposure to airway dentistry still is very slim in dental school.
Yeah, it is slim. It's better than it was when I was there, at least I went to UT
Hmm.
Houston for dental school. But yeah, that's a really interesting question. So it's kind of changed over the years. We used to, when we had the general practices, we hired right out of dental school. I've got a couple of scholarships at UT Houston, and we go to the Senior Award Center, and I'm just asking like the professors that taught me, I'm like, hey, I need another me. I know that sounds terrible. Like I need another one of like my
Oh, it's
family. Like who
fabulous.
do you love? Like they got to be able to talk to people and be compassionate and empathetic. I can teach everything else, but if you don't have empathy and kindness,
Yep.
like I can't teach that to you.
Right.
So it's been a great resource for us. And I always encourage doctors to get involved with the local dental school, whether it's your alma mater or not, because those professors, like the students are asking them, like, where can I get a job and where should I apply and things like that. So for a while we did the brand new dentist thing. And I mean, anybody can DM me. I'm happy to talk to anybody about it. It's very difficult because they're going to make mistakes. You get out of school as a brand new doctor and you're going to make mistakes. And so you've got to have like very good systems of mentoring them in your practice. You can't just like peace out. I'm going to take Monday and Friday off. You're good. You're by yourself.
Mhm.
That's going to be really difficult on your team. We've done it and it didn't work. So there are some things there. For the airway dentists, I'm not hiring any brand new grads.
Mhm.
I we even for our dental assistants, I need 3 years of dental assisting experience, preferably ortho. So there's some things that like we're growing so quickly that I can't take somebody and like this is how you hold a suction. You know what I mean? Like there were times where I was like, we will hire you right up, we'll teach you everything, but
Yep.
we need you to have
Yep.
some experience now. And the same goes for the dentist. Now, they don't need any airway experience
Mhm.
because first of all, they need to do it the way that I want them to do it anyway. So I need to teach them all of it. But
Yep.
I really want them to just be really kind, wonderful doctors that have filled some teeth, and are really interested in learning airway. And they will be paid very well and they'll be very successful in their towns with what we do to set it up. So as far as finding them,
Mhm.
my journey is a little bit different because I'm getting a lot of people that would like to work with us through my Instagram following, which has been nice. So I try to like consistently post, hey, we're hiring this city or that city, or hey, do you want to take my course? Do you want to learn more about what this is? And maybe you want to come work with us. So I'm
Yeah.
using social media, LinkedIn, Facebook, and my Instagram really to drive interest
Mhm.
around Houston. And then we lean on the local dental societies. So, like the Greater Houston Dental Society, my husband and I just did a talk for last Thursday. And we're actively in those just saying, like, if you're interested in this, you want to come work with us, we're looking for really good people. So
Yeah.
I would tell anybody that I feel like in your specific example, it's the me like 6 years ago that was tired of doing restorative at the same time of airway. It's all really, really hard. And what they're looking for is an associate for the general dentistry. So I
Mhm.
feel like you can do it two ways. You can find somebody that's brand new
Mhm.
and they will really appreciate the mentorship and the leadership that you're going to give them, having gone to practice for a while. Or you just find somebody that has been out. Maybe they've worked in corporate, which is like really difficult. They're probably working 6 days a week. They want a life. But you've got to find people to ask. So I would start with the dental schools. I start with the local dental societies and kind of go from there.
Awesome. Thank you so much for that. I'm sure that's going to be so helpful to a lot of the docs that are listening. And I'm so excited to talk about our next topic because I'm thinking back and I'm like, I'm pretty certain when I had Dr. Morale on the podcast. Oh, wait, no, I did have Dr. Goals on the podcast. So we did talk a little bit about tooth pillow,
Oh,
but
good.
like
Yeah.
super ventured into tooth pillow. So I'm super excited to talk more about tooth pillow. For anybody that doesn't know what tooth pillow is, tell us a little bit about how it came to be born.
So I love this story because I was the very first doctor for Toothpillow. Chad and Michelle, who are our president and CEO, who you know very well, came to me 2020, maybe 2021. I can't remember. And they're like, we have this wild idea. And I was very nervous. I was very nervous because at the time I was extremely overworked. I struggled with burnout. I have a whole podcast episode on burnout that I think is very like just illuminating to what it can be
Yeah.
like to do what you and I do in the world and dentistry and all that. And I was very nervous because I felt like the narrative in dentistry, it was like very close-minded sort of nervousness of me because the narrative in dentistry around teledentistry or direct to consumer was all this terrible stuff about Smile Direct Club, who has since gone bankrupt. And
Mhm.
so I wanted to make sure that we never had a DTC direct to consumer sort of like viewpoint, which is hard because there's a lot of rumors about us, as you know, and
Mhm.
making sure that we were delivering experiences that passed through a doctor every single time. Like you can't even go from A to B unless a doctor has reviewed your case. So we had, I mean, probably a year's worth of late night Zoom calls, tough conversations, really like I love Chad and Michelle dearly. And we were just like, how can we do this? Because I knew without a shadow of a doubt, I had done like more cases than anybody in the country in guidance appliances, like MyoBrace, Vivos guides, what we're using at the time. And I knew that it did not require you to be in my seat in my office. I knew that.
Mhm.
And I knew that if you were in the chair in my office, it needed to cost more. It had to cost more because I'm paying assistants and I have lights and bills and whatever. So I knew that there needed to be a change in access to the care and fee for the care. I knew that. And so I was like, if I know that without a shadow of a doubt that these things can do zero harm and
Mhm.
we are only going to help the kids and they really don't have to be sitting in my chair while I measure them,
Mhm.
we were going to do incredible things. And so I leaned on that and tried to get my like general dentist head like out of the picture because it can be so like suffocating sometimes to
Yes.
be comparing everything to practice, which is like what a lot of dentists that don't understand what we do, that is where they falter. Like, oh, well, you need this or you need that. I'm like, actually, you don't.
Mhm.
Actually, you really don't. Like, if you've done enough of these, you know when you need to refer. And that's the part that I think is probably worth saying right now. As we were building Toothpill, we knew that this could never be a one size fits all direct to consumer model that everybody got it
Mhm.
because some kids can't do that. Some kids must have in office treatment with expanders due to age, crowding, whatever. And people don't realize that we deny a large percentage, unfortunately, or fortunately, whichever way you look at it,
Mhm.
of this virtual care because it would not be appropriate. If I would not give your child a tooth pillow when you're sitting in my office, I'm not going to give your child a tooth pillow virtually for crying out loud. Like, so
Mhm.
yeah, that's just kind of like the basis of it. So we started very, very slow.
Mhm.
We sort of had this like small website and we found friends and family, a dear friend of mine from childhood actually, who could like have never afforded full price care in office. Her girls would never have had this, like, period. And I reached out to her because I could tell that they had signs of sleep disordered
Mhm.
breathing and some malocclusion and stuff like that. And I was like, you're going to think I'm crazy. Also, we hadn't talked in like a long time. I'm like, you're going to think I'm crazy. But I mean, life happens, right? I've been in dental school and like
Yeah.
college and all stuff. But I really think that your daughter would benefit from this treatment. And it will literally never be cheaper. It was like almost free. It wasn't free, but it was like almost free.
Mhm.
And I would love your feedback on the experience with our app as we build it and like all of this stuff. So we had, I don't remember the exact number, maybe
Yeah.
50 kids that we just basically mailed a box to. And it looked totally different than it does
Yep.
now. Like we have more stuff in ours now. We have more like, but it was like the magic is in the guidance appliance and the myofunctional therapy. So it was like, how do we just, first of all, tell people what the heck a tooth pillow is? Because actually, I came up with that name. I don't know if you know that, but it was like much heated debate and topic about what we named this company. But I had been calling those guides tooth pillows in my practice since like day one. I just thought it was a really cute name. I didn't like mouth guard because I feel like mouth guard comes with like other connotations, you know?
Definitely. Yeah. How you
So
can't be scared of a tooth pillow. Like it just sounds fun, friendly.
It's cute, right? I mean, it's about sleep. It's like a pillow for your teeth. I always told the kids, like, this is a pillow for your teeth. And
Yeah.
I would tell them, I always sit next to them in the chair and I'm like, I'm going to give you a pillow for your teeth. And they just like look at me and I'm like, isn't that so silly? Isn't it the
Yeah.
silliest thing to think that your teeth need a
Yeah.
pillow? And it just like blew up from there. So when we were deciding what to name the company, Brittany, I was like, guys, this company is going to be named Toothpillow.
I love it. I
And
love
I
it.
think they were just like, all right, let's move on to the next name. Like, whatever, we'll name it Toothpillow.
And I think that's one of the things people get confused a lot about. They think that talk about how the company is Toothpillow, but the guides talk about the different guides that we use because the guide is
Yeah,
actually Toothpillow.
right. And I make the mistake all the time of calling everything a tooth pill, regardless of brand, because I just do that at work. And I'm like,
Right.
the kids don't know what a myo brace is. They don't know what a Vivos guide is. Like, who cares?
Right.
But Toothpill is the name of the company. We are a virtual dental office basically in the sky. And your doctor reviews your case, all the photos, all the things we're worried about, going through your sleep questionnaire, and then they pick the appliance that is best for your child. So I call them all generic little tooth pillow, and I get in trouble all the time because it's just habit, but it's not. It's a guided growth appliance. Then whatever brand we use based on the way your child's jaw is growing is what you're going to get. But the actual overarching company name is Tooth Pillow.
It's so funny. This morning I was thinking about, the podcast and I was thinking to myself again about how I just want to bust all those myths that are out there about tooth pillow.
Yes.
Especially, and you already touched on it, but I want to talk about it a little more, like how people think that, and the only thing that is in my mind every time I think about this is, that Oprah Winfrey gif where like she's dishing out whatever.
Yes.
I'm like,
You
we're
get
just
a tooth pillow and you get
yeah,
a.
like
I
everybody gets a
know.
tooth pillow. Like, guys, that's not
Oh my.
true. I mean, just like
I
Dr. Phil
know.
just said, she's not giving every single person a tooth pillow in her office if that is not what they need. So, talk to us a little bit about how no, not everybody gets a tooth pillow. And for those that don't get a tooth pillow, it's not like, we're just like, peace out, figure it out on your own. You know,
Oh,
yeah,
absolutely.
so let's
Yeah.
talk
Yeah,
to us about
absolutely. So I mean, there are some things, the younger your child starts or the younger you submit for assessment, the higher the chances that I'm going to say yes. So Dr. Moralia and I,
Mhm.
we screen every single patient that comes through. And if we don't feel like it's appropriate, we're going to say no.
Mhm.
Okay. So just know that. So if you get accepted, that's a really good thing. Now, sometimes it's going to come with some strong paragraphs and wording of like your child's already 11, we need to be checking in constantly, you must do exactly what we recommend or
Mhm.
you are not going to have the results. I actually say the same thing to my in-office patients. I will sit there and say, listen, if you want the results that you see me post on social media for your child, that means you will wear this thing 1 to 2 hours a day and all night. You will do nasal hygiene and you will do myofunctional therapy. You want what I do, you have to do what I'm asking you to do.
Mhm.
So it's really, really strict verbiage. But yeah, not everybody gets one. It all is going to depend on the patient. But it is more rare to deny the younger they are,
Mhm.
unless there are some serious growth deficiencies. They've maybe have an unrepaired cleft lip or palate, for example. We see all of the most of severe cases now because it's so easy to submit for an assessment. So we take those very seriously. Now, if you are denied virtual care, we have doctors all over the country. I'm very, very strict in particular about who I recommend because I know I've seen cases go wrong where teeth were extracted for the sake of straight teeth. And it would absolutely kill me if a child's parents like submitted for virtual care and then end up in the wrong place and then something is done that I would not have personally recommended for them. So it's really important. We have a team that will work with you to help you find somebody. I always try to advise the parents, please get in the car. I don't care how far it is. I really don't. But that's a personal problem for me because I'm like, it's worth who you go see to
Yeah.
try to see our actual tooth pillow providers.
Mhm.
So that's really important to me because I'm like, if I can let you see the person that already works for me and you're seeing them in their practice, like I have no fear. I have no fear about what they're going to recommend or what's going to happen there. So it is a really important method. I've spent the last year trying to bust. And I think it's also a blessing that Tooth Pillow is so popular now. I mean, our
Yeah.
following on social media, the number of cases
Yep.
we're doing, like it was always kind of my legacy that I wanted people to know what a tooth pillow was. And I'm like, I feel like now so many people know what a tooth pillow was, which would not be possible if we had not started this company. It's just like
Yeah.
I'm one little dentist in League City, Texas. Like there's no chance people would have known.
Mhm.
So yeah, the earlier the better.
Yep.
And, help us bust this myth. If you hear somebody talk about that on Facebook, I tend to just ignore it now and like roll my eyes and I'm like, they just honestly have no idea.
Yeah, and I think too, to the people that are listening, that you have maybe negative things to say or believe these myths or whatever, like just reach out and ask. Everybody at Toothpillow is very open and communicative, and just ask. Like before you think or say, if you don't know, find out and ask. I mean, I don't think that's the
A
part I struggle
hundred
with the
percent.
most is like
Yes.
if I doubted something, especially when it comes to say I'm seeing a patient and I'm doubting what their recommendation was by X doctor, like I'm gonna reach out and I'm gonna figure out more about it before I formulate my own opinion based off of what other people are saying. Like that goes with anything in
A
life.
100%. No, that you would think pretty would be common sense, but
Yeah,
I'm in these dental groups. They are vicious. Like
for sure.
there's a lot of them I have left
Girl,
because I'm
I'm a
like, guys,
myofunctional therapist. It don't get more
oh
vicious.
yeah. I know. I mean, it's just so wild to me. I used to be, early on in my airway career, way pre-tooth pillow, I would get so frustrated when people would talk about how I was doing adult expansion or how it was wrong or like whatever. And I'm like, if you have not used the appliance that I'm using, I don't want anything to come out of your mouth because you don't know.
Right.
It's
Right.
really frustrating. I'd like to just assume. So I'm always just like, if you don't know about it, don't talk about it. Like
Literally.
ask
Yeah.
before you're just on a public forum degrading somebody's like reputation or whatever else. But you know what? Teach their own. I don't know. I'm like, whatever. Like,
I
just
hear you.
please reach out to me or you, and we will make sure that like we clear anything up. And our patients, the other thing, I'm like, talk to a patient that's gone through the treatment because
Right.
they are the biggest cheerleaders for it.
Yep.
Like the proof is in the pudding. I told our founders like early on, I'm like, if this appliance didn't work, we would not still be a company. Like if this
Right.
thing was really bad, we would have lasted one batch of sends and we'd never got another order.
Yep.
I mean, we've treated over 8,000 kids virtually. And what I need some of these other dentists to understand is that those patients were not going to find you and drive to you. Like
Right.
I did have the unique experience where people have flown to see me and like they've driven 7 hours in Texas. Like
Mhm.
the patients that have the means for that,
Mhm.
that's not who I'm talking about. I'm
Right.
talking to people that live in the middle of Kentucky or the
Right.
middle of Ohio. And there's nobody. And they can just get on an airplane every other month and come see you for their expander or their tooth pill to get checked. So think about the greater good here and just understand that the people that are behind this company,
Mhm.
we do care about our reputations. And we would not have built something that was unsafe or going to do harm to any child.
100%. 100%. All right, let's move on to the next myth. Some things that I'm just thinking of the things that I see out there on like social media and whatnot, that some people are saying that you shouldn't be doing this virtually without a CBCT. So let's talk a little bit about that.
Yeah, I figured this would probably come up. So when we're treating younger children, absolutely no need. Absolutely no need early on. And what people need to understand is we're not doing like we're not doing like braces or expanders or something virtually. Okay, we are providing them with a habit corrector style appliance that is just going to help them breathe through their nose and lift their tongue to the roof of their mouth. So
Mhm.
we need to be very particular in what y'all think we're treating before you jump to conclusions.
Mhm.
Now, another myth is that we don't ask for copies of panoramics.
Mhm.
Panoramics. Okay. We ask for copies of panoramics if they have them
Mhm.
all the time, especially in the older kids. I definitely want to find out where those canines are.
Mhm.
Okay. And I definitely want to, I'm not going to not let them use something that's going to help them breathe better and sleep better and improve their musculature.
Mhm.
But if I see something on the pano that indicates that they've got severe crowding and they need expansion, they're going to get referred.
Mhm.
So what people probably assume is that we're promising straight teeth
Mhm.
and we're promising that all their teeth are going to come in.
Mhm.
We're not saying that at all. We have major like sentences in our waivers and consent forms.
Mhm.
We are very clear about what we say the tooth pillow can do. The side effect is very cosmetic, but we are not telling those patients they're not going to need phase two expanders or ortho. We are not
Mhm.
telling them that.
Mhm. And I think that that's, again, so important that people understand because, again, nobody's coming out here and saying that these tooth pillow appliances, guidance appliances are expanders. Nobody's making that claim. And so it's frustrating, again, when you read these things,
100%.
whoa, wait a sec, because now you're putting words in people's mouths. And these providers, I mean, you
Right.
guys are, the team of chief clinical officers, you guys are incredible and you have treated thousands of cases
Totally.
successfully. And you have
Right.
your own kids. So, you're treating every kid like they're your own. Um,
Absolutely.
yeah, and
Yeah.
it's frustrating. I think my other next frustrating subject that I see a lot on is people saying that they are going to cause retractiveness in cases.
Oh yeah, we've never seen that at all. It's actually wild. It's a wild thought to me because the way the guides and the habit correctors fit over the teeth, they don't put any pressure on the teeth. They actually lift the lip up off the teeth. So your lip, your upper lip can cause some retraction and muscle pressure if it's not acting properly too. So we all just kind of like scratch our heads because we've never seen that happen. And even in our private practices, you can have some weird little bite changes. I mean, they're kind of being held a little bit more in class one. Anything like weird like that happens, we take a few days break, things settle. Like there's just never been actual like harm caused by these appliances. So typically when I read something really weird like that, I just assume like that person's never done one. Like, and if you've done one versus over 8,000, like there's just a lot to learn from that. And I'd rather them, again, just like reach out and ask us or show us a case where you think that happened and we'd be happy to talk you through it.
Right. And I think too, maybe where people are seeing this, maybe they're not getting the myofunctional therapy, right? To your point, if those
Totally.
muscles aren't corrected, the muscles are going to do more harm than these appliances are never going to do any harm if we're not getting that muscle function fixed. And that's another big Oprah Winfrey gift. Like everybody gets this custom myofunctional therapy program. Everybody gets these, same 10 exercises. And I mean, I can obviously speak to that as the co-director of the Myo program. Every single patient that comes into Toothpillow is recommended custom myofunctional therapy.
Every single one.
Just like, and this part blows my mind too, because I think about like how I am in private practice. Um, you also have to meet patients where they are. And some
Absolutely.
patients,
Oh my
like
gosh.
like that, like let's
Yes.
not forget that they're really what's most important. And maybe they're not ready for a custom myofunctional therapy program yet. Or maybe we want them to get used to this appliance for a little bit before we start their custom myofunctional therapy program. So we're giving them some things that they can work on. So A, it's going to, of course, we know only help the guidance appliance work more. But B, it's also helping these families understand, like, wait, we can't do this on our own. Like, I can't, just like you can't, if you don't know what you're doing at the gym, you're not going to go to the gym and wind up like a monkey,
Absolutely.
right? Like, you have to have somebody that's
Absolutely.
assisting you through this. So, talk a little
Right.
bit from the doctor side, how much the myo is stressed, because this really like just gets under my skin so bad.
It is just wild. Yeah. Like we were talking earlier about people being vicious. I'm like, both sides. I'm like, I always just was blown away that any OMT would look at what we were doing and be like upset about it by any way. Like, I'm like, do you know how many more people know what myofunctional therapy is now that Toothpill is around? Because we insist on having it as a part of our group. And Dr. Ben Ralia was absolutely critical in that as we were building everything because we knew we had to have myo and we knew it couldn't be in person. It couldn't be in person for every single patient. Are you kidding? Like, that is crazy. Also, I have a myofunctional therapist in every single one of my locations. Myofunctional therapy is so important that we have it in our operating, like opening business plans for our locations at the airway dentists. So it's like, if we know that we need it that much, how could we not bring it to virtual care in some manner? And so the fact that we have somebody like you and all the team of myos that you're training that will actually get on live, like the doctors aren't even live with the patient. We're chiming in behind the scenes. We're sending them videos. Like you guys are literally their like connection from we are not just a DTC computer program that they're never going to hear from anybody. Like it's so critical. So to me, like unfortunately, I feel like it becomes this like turf war thing. And I have to remind people like these patients wouldn't have come to see you anyway. Like they couldn't have gotten to you. Like
Like, I'm
if you think
sorry, you
about it,
might
like
be the best myofunctional therapist ever, but nobody's driving 3 hours once a week for 4 to 6 months. Like, they're just not going to do
correct. Yes. So instead, join us because if
it.
you're really that good, we would love to have you as part of our virtual like program. So, anyways,
Absolutely.
yeah, it's a lot, and I think really at the end of the day, where Tooth Pillow has the biggest probably battle, if I had to say, pick a word, would just be in education because nobody knows who we are. Nobody knows what it is, or at least in the beginning.
Mhm.
In the entire, all this mom army that is being built around, oh my gosh, my kid is not bedwetting anymore. Oh my gosh, look at their teeth. Like the proof is in the pudding. So as this continues to grow, you guys just need to be proud of yourselves that you're a part of myofunctional therapy in
Yes.
general because
Yep.
the world is waking up to it. And that is a really exciting time instead of fighting us about the way that we're providing the care.
And like you just led me to the I wasn't even thinking of bringing this up, but now the fact that people have issues with the way the marketing goes with Toothpillow in you like utilizing the mom army, which is crazy to me because when we're going to go to the source. The moms are the ones that are looking for this stuff, Googling it, trying to help their baby, like not wanting to take no for an answer or they'll grow out of it. Like who better to spread they're literally doing us a favor. They are spreading awareness. Every single
Absolutely they
mom
are.
army is reaching
Yeah.
exponentially more people than you ever would as me as a mile. Do you know what I mean? So like the fact that people get upset about that, I'm like, I just don't understand. They are not
Yeah, I
getting.
think yeah, they lash out when something, people tend to go to anger or stress when they're anxious about something and when they don't maybe fully understand something. So if they're looking at it like, well, I don't even know how to do that in my practice. So now I'm going to be mad because they're going to ask about it and I wish they just weren't telling anybody because I don't know. It's all very much about their own like insecurity. But I will tell you, when I first started doing airway, the mom Facebook groups around Houston literally single handedly grew my practice.
Yeah.
So when it came time to have an explosion of a virtual company like Toothpillow,
Hmm.
I was like, we need to tap into every mom that has ever, like in California, Oregon, like Florida, Texas, that has ever been in office and had one of these because they will literally vouch for us because they know it's a real thing. This isn't just something you can get at Walmart, right?
Yeah. And
So
everybody's
I feel
part of these mom groups, like putting in their 2 cents about airways.
100%.
So we're
Oh
doing
my
the
gosh.
same thing, but
Yeah.
on a much larger scale. So that's the part I almost feel
Yeah,
like it's almost hypocritical of some people.
it is. It is.
Um, yeah,
Right.
and I just want to point out too, as we were talking about the myo part, just so everybody knows this as well. If a patient is going to do better with their myofunctional therapy in person, we too are suggesting that they are seeing somebody in person. We help direct them to somebody that's as local as we can get. If there isn't anybody as local, of course, we're not going to completely deny the patient. We will do our best with the family's understanding that your child really is needs in-person myo. So I just want everybody out there again to know that same thing with Mayo. We're not just saying virtual Mayo for everybody, right? Because it's not for everybody. So
Right.
I just wanted to
I
throw.
really appreciate you clarifying that because I think at the end of the day, people get nervous if they think that everything is just, cookie cutter.
One size fits all.
And again, just ask, like for crying out loud, just ask us, hey, can you tell me what your program is like? I do
Yeah,
Myo in Florida. I would love to know more. And
yeah,
just be kind. Like it does not, it just be kind.
yeah, exactly. And I mean, if anybody's ever listened to me talk or have taken one of my courses, like I do not believe in cookie cutter myofunctional therapy approaches. And I was first trained with a cookie cutter myofunctional therapy program. And I remember being in practice and
Wow.
being like, this isn't working. What am I supposed to do? Like, I have my sheet that has sessions, whatever, 1 to 12, and I'm on session 3, and patient should be doing X exercise and they can't do it. What do I do
Wow.
now? Right. And so, I'm so excited to be part of Toothpill and part of the Myo program because for, interns that are coming in that maybe have, and I don't want to say unfortunately, because there's still a lot of great Myo programs out there, but teaching more of a cookie cutter approach, Laura and myself are helping them get out of that mindset because you're never going to be a good myofunctional therapist if you can't think on your toes, if you don't understand why you're giving a specific exercise.
Oh,
What are you
absolutely.
trying to target? Um,
Absolutely.
so, I love what we've been doing with the Myo program and building that intern program. And it's just been, again, an honor and a privilege to be part of it. So I thank you for that.
Thank you. Yes, I really appreciate Brittany. And I tell everybody that asks me, like, where can I get my hygienist trained or wherever, I send them to you. I'm like, the only one that I know that well that I trust. And I mean, I want more myofunctional therapists to work with you. I really do. I want to
Mhm.
have it's like just join us and learn what it's about, and you will be a complete believer because the families that you're going to help are eternally grateful, and it's wonderful and it's happening and it's like a freight train. We have just the largest myofunctional therapy company in the world from what I
Yes.
understand. I don't
Yeah.
know if you know of any bigger, but the number that we're onboarding every single month, it's like we need good help. So
Yeah, we have an amazing, amazing team. Anybody that's looking to do some virtual Myo, I mean, at the end of the day, it is nice as a mom to be able to be home and, keep your
yes.
schedule around it. So we're always looking, to build our team of therapists. I do want to bring up another topic that I feel like I always am talking with airway docs about because when it comes to ENTs, I am curious in your area, do you have your go-to ENTs for pediatrics and adults? I always feel like these are the toughest providers to get
They
on.
are. And yes, we do. It has taken a lot of blood, sweat, and tears to get there, though. It started kind of organically for me way before Toothpillow ever existed. And I found somebody, usually word of mouth, usually from a mom who had been to an ENT that was like, hey, do you know of any airway dentists? Like you should get an expansion or whatever. And I was like, oh my gosh, I need to talk to them because they don't know I exist if I don't go talk to them. So I'm always telling
Right.
other dentists that are like the doctors that I mentor. I am pushing them every month. I'm like, who have you reached out to? You can send a letter. If you don't feel like you have time to go drop off a goodie basket, like send that ENT a letter. So it's really important, in my opinion, as the provider, that you know who you're referring to.
Mhm.
So I can't stress that enough. Like if all they're doing is pulling tonsils, nanoids all day, and they whatever, you should go have lunch with them if you've referred to them for a long time. If you're doing airway, to pick their brain about something else. Like let me show you what I'm doing. Let me show you the resolution we've had in shrinking those. Would you be willing to like screen them with me and like walk through this with me? So we do have that, and actually it's part of our location building prior to opening for our locations too. Is I host a dinner. I host what we call a provider dinner,
Mhm.
and we have physicians, functional medicine, chiropractic, like OT, myo, like speech pathology, like, and we have everybody that we can find that we believe would be a good referral source for the practice back and forth, and educate them on like what we do and what our mission is. So another little tip for anybody that's wanting to build that referral is reach out to your community, buy them a nice dinner, talk about yourself, and go from there.
Now, what are your and I guess standard typical protocol, I guess, as far as referring to an ENT, like is it every patient's going to see the ENT? Is it when tonsils are grade 3, 4, when we're seeing like tell me a little bit about, I guess what I'm trying to get at, are there cases where you want to try some type of expansion first prior to sending them over to an ENT?
So this is probably just the Dr. Kalli Hale, the airway dentist hat versus like the Toothpillow hat, just because I don't want to speak blatantly for everybody. But I will tell you that I'm very aggressive in expansion first prior to referral to ENT for tonsillectomy. And just because of the literature that we're seeing coming out from Dr. Yoon and all the great people that are studying this,
Mhm.
and parents really don't want to jump to surgery first. I haven't met anybody that did. I will tell you, sometimes I have to be very strict and tell them you need these out. Like if I see a child that has horrific obstructive sleep apnea, their chest is caving in, they're stopping breathing. Mom is showing me videos. Like,
Mhm.
yeah, I can probably make them smaller, but like, how long are they going to suffer before they
Right,
actually shrink?
right.
And the hypoxia is very scary to me. Like a lot of work coming from David Gozal showing the neurology impact and some of the irreversibility of hypoxia. So you definitely have to know what you're doing, which is why I have a mentor group, because I'm like, let's mentor each other. Let's be in groups together to talk about it, because the
Right.
experience really does matter. So yeah, I'm usually have a corrector myo first, expanders prior to referring for removal, and they got to be really big. I mean, for kissing, touching, for me to be saying take them out. Yeah.
And then what about so I know you have a myofunctional therapist at each of your locations. How has collaborating with myofunctional therapy improved your outcomes?
I mean, it's sort of if you want it to succeed, you do therapy with it. So, and I know that's a little bit aggressive, but that's just like how passionate I am about it. My hygienist who's been with me, she just celebrated 10 years with me. She's been a hygienist longer than that.
Oh, that's
And
awesome.
when I bought the practice, she was, anyways, she was kind of part time, and I was like, it took me. I honestly, like, if Tara listens to this, I'll just send it to her. Maybe 3 years until she probably felt safe enough to like come to me full time, and I was just like begging her. And they were there before I was ever an airway dentist. I just am forever grateful. And she went and did a myo course in Dallas all on her own, paid for it on her own, everything. Just like, and I was so thankful because I knew I needed it. I just didn't realize how much I needed it. And especially if you're a dentist that does frenectomy, it's like I do releases even on newborn babies. So like I gotta have somebody that's like very much in the know with me. And she set such a precedence for how I view myofunctional therapy, how I talk to other dentists about treating their myofunctional therapists in office or outside or whatever. So I can't recommend it highly enough. And I think you and I both know with anything, even Toothpillow, like there are some families who are just not going to be able to afford both, one or the other, right? So you have to like a kid that's got speech impediments, severe swallow dysfunctions and stuff, they might be doing myo first. They might be doing myo before they can pay for a tooth pillow, or it'll be the other way around. Like
Mhm.
they're older and I've got extreme orthodontic stuff that I need to start correcting. And then we take the expanders out and then they do myo, so it
Right,
just like,
right.
whatever you, just like you said, you have to meet these families where they're at, and we can all come up with like the perfect world scenario in our mind, but I guarantee you that is not real life, and that's not how it's going to be for every family. So
Oh my God, 100%, 100%. And what about as far as and again, I know it's always so hard because every patient's so different, but I guess typically in your practice, like when do you find yourself recommending an expander over a guidance appliance? Like what is going
age. So the easiest way to say that is age. So if
on?
you're 10, and I mean if your canines are blocked out, it's immediate expanders.
Mhm.
Now, it's kind of unique. One of my techniques that I came up with early on when I got trained in expanders was to utilize a habit corrector with them, which a lot of people don't do. So in my training courses, I'm teaching them like what size fits over it, and like I want the kids wearing them over the expanders because I want them breathing through their nose like at the same time.
Right.
So yeah, so it's basically it's age and severity. So if you've got a totally like you just have a little bit of a class 2 deep bite, the canines are fine, everything's coming in, like that's going to be a tooth pillowcase for me. But
Mhm.
if you have like very narrow upper and lower jaws, and I know that a guidance appliance alone is not going to be able to get the job done, and we're going to do expanders at the same time, we're still going to use the guide. So I'm like, we're still having a tooth pillow. Every scenario is myo and tooth pillow. It's just as far as where it fits into the picture is the biggest thing.
Right. Yeah.
So.
And what about because I think that another thing that a lot of airway docs, and I don't want to say a lot, but maybe newer airway docs kind of struggle with is getting like how do you guide families to understand that the tooth pillow appliances aren't the fix all. The expander alone is not the fix all, that it's really the combination of getting that muscle function down. So how do you help
Yeah,
families to kind of understand really the role of the muscles?
I mean, it's just really stellar communication. Like, and that's not a cop out. It's just like you
Yeah.
really, as their provider, have to know what you're talking about.
Mhm.
I'm giving a lecture in July at the ADA, the Pediatric Airway Summit, specifically, basically on that,
Oh, that's
because they want to know, why is your case acceptance so high?
mhm.
Why in our practices are they so high for the doctors I've trained? Even the doctors that are, I don't know their practices and I'm just mentoring them. Like, if you don't know how to talk about it, if you can't explain it simply enough,
Mhm.
then you can't teach it, right? Like, you have to be able to put it in words that your doctor brain or your OMT brain,
Mhm.
but layman's terms for the parents.
Yeah.
And it really does make sense to them when we explain it well. Like, your tongue is your natural palate expander. There's actually a right way to swallow. Like,
Mhm.
things that you think you just do naturally, right? Like breathing. Like, there's a right way to breathe too. Like, there's all sorts of stuff coming out. So for me, it's just like intense communication with them, making sure they really understand. And even if they don't, like, even if they couldn't rattle off exactly what I said or what you said,
Mhm.
the trust has to be there. So for me, it's the communication in a way that they know that they can tell me anything. It's a safe environment. I've seen it, I've treated it, and this is the easiest case I'm going to do today, kind of thing.
Yeah, absolutely. Again, it always comes down to communication, education, and empathy. Like going back to how you don't hire,
Oh,
like you
yes.
have to, there is nothing like I don't understand people that get into any kind of healthcare that don't have like good bedside manner. Like how
I
expect to be
know.
successful? Like you could be the best clinician and well, no, not even because a clinician is both, right? Like it's
Yeah,
not
but you might not have a good business. You could do a filling really, really well, but you might not have people that are coming back to you.
right.
Like, you will have no business.
Oh my gosh.
Yeah.
All right, my final question to you is what is one thing that you wish that every parent and or provider understood about growth and airway development?
That is, in my opinion, the single most important decision they will make. That
Mm-hmm.
you should get multiple opinions. And I truly do think that this specific decision now, where our jaws are, all the generations of damage leading up to having babies right now in 2025,
Mm-hmm.
that you must make a good decision on your child's jaw growth and development, because it single-handedly changes the way they age.
Mm-hmm. Absolutely.
So
100%.
that would probably be my thing. I know that's not guiding them to a specific treatment, but it's like, you need to find your people, the doctor and dentist you trust, DM us, whatever,
Yeah.
because this is very important. And I want you to be part of that decision. Like, I want the parent to be totally understanding what we're doing, how they can get from A to Z to make sure that they have properly functioning jaws and airways.
Yeah, no, I love that. I think just putting that emphasis on it, like the time is now, right? Like we don't want to wait. When we're
Absolutely.
seeing that first
Yes,
sign of dysfunction, that first sign of underdevelopment, what are we waiting for? Because it's
absolutely.
not going to self-correct.
Right. Right.
Is there anything else you'd like to leave the listeners with before we wrap up? How about where to find
I think
when they find you?
yes, that would be great. Yeah, so I am the airway-centered dentist, all spelled out on Instagram. Locally, we're the airwaydentists.com, which is plural. Obviously, Toothpillow Official is our Instagram handle for Toothpillow. Submit your child for an assessment. It takes like 5 minutes. We have a bunch of questions. You do need your child present because we need photos of your little one. But just if you have any questions, if you are on the fence, or if you want to work with us, please reach out to any of those avenues, and we will help you.
Absolutely. Oh my gosh, thank you so much for coming on, Dr. Hale. It's been a blast.
Thank you, Brittany. I hope to do it again sometime.